everyone's time, we'll go ahead and get this started. If y'all will join me in a pledge of allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
And bow our heads. As we gather tonight to serve our community, let us take a moment to center ourselves in purpose. We come together with shared commitment to uphold dignity, advance equity, and to support the well-being of every individual and family that we serve in Union County. May our dialogue be thoughtful, our decisions guided by compassion and wisdom, and our collective efforts grounded in integrity and inclusion. Thank you for your presence and your continued dedication to this important work. Amen.
Amen.
Has everyone had a chance to look at the minutes from our previous meeting? Do we have any questions or approval of the minutes? Ashley proposing. Do we have a second? Second. Thank you. All in favor, say aye.
Aye.
Any opposition? All right, the minutes are approved. Next is our agenda. Has everyone had a chance to look over? It's a very full agenda. And then we are considering that for approval tonight.
A motion to approve the agenda.
Any second?
Second.
All in favor?
Aye.
Any opposition? And the agenda has passed as well. Next on our agenda is the Executive Director's Report.
Thank you for coming out and this beautiful weather we've had today. So I actually have only one agenda item to cover, and that is in regard to the membership of the Consolidated Human Services Board. And I wanted to let you all know, so Dr. Bott's term is actually expired April 30th, and he is not reapplying for appointment, and so that position has been posted. So I wanted to encourage you all to recruit any eligible candidates that you think might be good to serve in the optometrist position to apply, and also certainly want to thank him for his service. It has been a real pleasure to work with him over the past couple of years, and actually we will be able to continue working with him in his role in conjunction with the Vision Care Partnership that we've talked with you guys about previously, and he's going to continue enabling the Human Services Agency to partner in that regard, so that's very much appreciated. We do have an application that I would like to submit to you for your consideration, and that is for Mr. Earl Ford. And his position is actually not expiring until July 31st, but we, at that point, will have 2 vacant consumer positions, and Mr. Ford has gone ahead and submitted his application to be reappointed, and for your consideration for that, he is eligible to serve an additional term. And since we have not received any other applications, so that position, the current vacant position, has been posted. We have not yet received any applications for that. When Mr. Ford's position becomes vacant July 31st, that would mean we would have 2. And so we felt like it was appropriate to go ahead and bring this before you all tonight for your consideration, so that if you would like to make a recommendation to move this forward to the Board of County Commissioners, then we could go ahead and get that on their agenda in either late June or July. I believe they only have 1 meeting in July, and so wanted to be able to be prepared to do that so that there would not be a break in service if there was a recommendation to move that application forward.
Thank you, Janet. Is that the only thing
That
I'm
is
missing?
the only one for this
So
month.
if we, as long as we have consensus and there is no opposition, and if there is a second, I would make a motion that we move forward with Mr. Ford's.
I'll second.
All those in favor?
Aye.
Anyone opposed? Congratulations, Mr. Ford. Yay!
Thank you.
Next on tonight's agenda is the division report.
All right, we're gonna wait a minute for them to bring the slides up. All right, I'm here tonight to talk about our State of the County Health Report. So we do the State of the County Health Report in the years between our community health assessments. So we do our community health assessment every 3 years. We're actually doing one this year. This is State of the County Health Report is for last year. It was submitted to the state in March, and we're still waiting to get final approval, but we don't anticipate that being an issue. But what's in the State of the County Health Report, we look at the progress that we've made on our Community Health Improvement Plan. So the Community Health Improvement Plan, just for those who aren't aware, it's an action plan that comes out of our Community Health Assessment. We select priority areas and focus areas, and then we do an action plan, and that's done by our Healthy Union collaborative, and then we submit that to the state. So this includes the progress on the CHIP, we call it the CHIP, and then also any changes in morbidity and mortality rates, as well as any emerging health issues, new initiatives in health, and then any paused initiatives that we have. And by the way, this will be in a pretty report format. We just want to wait for final approval before we do that. And then I'll be working with our communication staff, Nicole, who's right there. She does wonderful work. We'll be working on that report. So just to start out with, our first priority area that our focus area from our Community Health Improvement Plan is affordable housing and homelessness. And one of the things that we do is we come up with a result statement, which is a vision statement, pretty much what we want to see in our community. And we came up with all people in Union County have access to safe, healthy, and affordable housing. And then under each area, we have indicators, which is what I'm going to go to after this slide, which are some community population health measures. And then we have some strategies that we're doing to address that, as well as some programs. So one of the strategies we did have was we did a housing symposium in early 2024 and had invited community partners as well as decision makers, county, municipalities, etc., just to bring more awareness to the issue. And then a few of the programs that we have in our community currently is the Rapid Rehousing Program, Emergency Shelter Program, both of which are at the community shelter. So just one of the indicators that we have here is just looking at the hourly wage that is required to be able to afford a 2-bedroom apartment here in Union County. And I apologize that we don't have the 2025 estimated hourly wages for the renters in Union County, but you can see what 2024 was. And then the line above that in orange is the one that shows you how much you need to make to be able to afford a 2-bedroom apartment here in Union County. And you can see that there's a really huge discrepancy between the two. And it's just growing, that discrepancy. And then another indicator that we have here is the percent of cost burden renters and homeowners in Union County. So what cost burden means is that you pay more than 30% of your salary towards your rent or your home. And so what we did was we looked at first on the bottom, you can see is the percent of cost burden homeowners in the very light blue. On the top in the orange are the percent of renters who are cost burden, and that line in the middle is the average between the two. Yes?
Can I just ask a quick question?
Yeah.
A major talking point to combat this issue, this crisis, is affordable housing. Everybody keeps hearing affordable housing. So tons of housing is going up. but the gap is getting larger. What am I missing that?
There's no affordable housing going up.
Okay, so it's really not affordable housing is what's
Mhm.
happening.
Correct. And then another indicator that we have here are the number of homeless in Union County. And this is what the information that I've received from the community shelter. So it's not only the number of people who've been in the emergency shelter, but it's also those who are at Turning Point, which is our domestic violence shelter. It could be also those who counted by the school system. So some of our homeless youth and families that might be couch surfing or living, et cetera, in our community, and also those who are living in tents in our community. So it's just an estimate. It's probably on the lower side, but that's about the number of homeless that we have in our county. So just some updates on the strategy and the programs. Again, we hosted that affordable housing symposium, and I think it was really well received, and the information, we're hoping to push the needle on that to some degree on affordable housing, but we really haven't gotten too far. But there are some initiatives with Thrive Union, and really they're trying to look at ways that we could work with the different municipalities and counties on that. We did see the increase in demand for housing. We also have a low supply of housing in our community. If you look at vacancies, it's really low. So it's below 5%, which is really, really minuscule. So what there is available, there isn't much available, and what is available isn't affordable. And then there's also some barriers in addition to that. We have rising rent. So what we saw during COVID was that a lot of rents were being increased around the county, like even for people who have fixed incomes, like people on Social Security that depend upon their Social Security to pay for their rent, or other types of stable income that just hasn't gone up, but people were increasing to the point where, some of our elderly were losing their housing. We're also seeing some stagnant wages, so we're not seeing a huge spike or increase in wages. Again, low vacancies. And then a lot of the people looking for housing have really poor credit. So it is really difficult to find housing when your credit's really poor. And then there's a lot of income instability with some of the populations that are looking for housing. Another issue that we're seeing is the shelter wait list is really long. So they do have some families, the capacity to take in families, but that wait list is about 2 or 3 months. And then even for the men and the women's, that part of the shelter, there's been like sometimes a week or 2 wait lists for people to get in, which is really, really difficult. And then at the shelter, they're seeing a huge increase in the number of seniors and families that are looking for shelter. So I know there's a lot of perceptions about the type of people that are at the homeless shelter. And yes, there are some chronic homeless that end up there, but that's probably only about 15% of the population that they're seeing. What they're seeing now are more seniors, again, that are losing housing because the rents have gone up and they can't afford their housing. And then families who may have lost their housing as well. So those are just some of the issues that we're seeing in our community, which is what we're seeing across the nation. It's not just our community, we're seeing it across the state and across the nation. The second priority area.
Can I ask a question?
Yeah, of course.
Go ahead. I'll let Mr. Ford go first.
I want to ask a question, Stephanie. I see, the chart shows that it's just going to get, just like Brandon says, the gap's getting wider and wider. And I was just wondering, and you're right, it is across the nation, but if there's no tools or some type of tools, possibly I was listening to a report, I think it was on NPR, that some communities are contacting the builders or trying to put these homes up. They're getting like mixed use like some, they had to make so many that would be considered affordable, but they would still be in that same neighborhood. But it was something, a way that, because they said they had some police officers and probably some eligibility workers here, if they're
Right.
single, they might not be able to afford a house and maybe they want to
Exactly.
come here.
Yeah,
So-
and that's what I was gonna say, it's not just people with low wages. You're talking about some of our teachers and some of our police officers, you're talking about some of our workers here. And you're right, if they're single, they can't afford a lot of housing. And yes, there are some incentive programs out there, but you have to have builders that are willing to do that. And then there's also, and again, there's a lot that goes into it, but there's lots of regulation. So even when some builders are really interested in those programs, I know that it can get caught up in regulations on the state level. So a lot of hoops that I think the builders have to jump through in order to do that, but then they also have to be willing to do it as
That's what
well.
I'm thinking something like this might, if it's critical and it's important, maybe something like this, maybe something could be drafted for the Board of Commissioners. Something, because they would have to get involved to, when people want to put these new subdivisions in, maybe that's something where some leverage could happen at that level, because otherwise it's just going to get wider and wider if we don't have some type of tools or some type of plan. We'll just be reporting on, I hate to see Union County become one of those counties where we've got so many homeless people or people who are professionals who just can't afford a house or rent.
Right. And it's not just the county, it's also the municipalities that need to do that. And some of it's zoning laws. I mean, there's a lot that goes into that.
My question's similar to that. You had noted that there was the rental vacancies of less than 5%. Do we know if we've had involvement with the RealPage scandal to raise the rents at this rate? I know it was confirmed by the North Carolina Department of Justice to be in Mecklenburg County. Didn't know, and they were part of that lawsuit, and I didn't know if it had
I don't know.
spilled over to Union.
I mean, it would be interesting. I know that the shelter probably has more awareness about that.
And then with regard to municipalities and homeless, I know Monroe has recently made it illegal to be homeless there. Have any, I mean, to me, that's very concerning. That's not the way out, especially when they passed on grant money. But is that the case in any of the other places?
Not that I'm aware of. But I do know on the state level, there's been legislation as well. So, advocating for more affordable housing and ways for the county to do that would be very advantageous for everyone here. On the mental health, in the mental health arena, that's our second priority area. I'm not going to read off the slide because there's a lot of information on here. And again, we developed a results statement. We have a few strategies that we are following. So we do some mental health awareness and education in the community. So, you know, we do some public communications, and so does the schools, and just try to get awareness about the mental health issues and the impact. And then also, you know, we've been working on looking at our mental health providers in Union County and coming up with some plans. So again, this is 2024. There's some other stuff going on this year, so I'm just going to talk a little bit about some of the programs in a few minutes. So a couple of indicators, and this indicator is actually moving in a better direction than some of the other ones. So the number of emergency department visits, and focus on the 0 to 17-year-olds, because I know during COVID that was a huge concern, the mental health issues of our children. Not that it's not concerning for all populations, but I know for the school-age kids. But we are definitely seeing a decrease in that. And again, I know these measures are always, by the way, they're always lagging a year or two, at least a year, usually 2 years. But we have definitely seen a decrease in the emergency department visits for things like suicidal ideation, depression, and self-inflicted injuries. So that is positive. And then the next one, okay, please don't, I'm going to redo this slide. I know it's wrong. So this is the suicide mortality rates in Union County, and this is per 100,000 people. So I don't want you to get alarmed at the number. And I can say that this graph is not age adjusted, which is something you have to do when you are looking at statistics. So I went back and looked at some of the numbers, and so in 2019, the rate was at 10.2. Actually, in 2020, it was at 9.7. In 2021, it was 9.0. In 2022, it was 10.3. But I do believe that the rates are starting to decline again. Again, that's the number of people per 100,000. So, but it's always concerning when you see any kind of suicidality or the rates increasing. So it's gone up slightly. It hasn't gone up as significantly as the slide indicates, and I apologize. So just some progress. As you know, and I think we've had this presentation on our behavioral health collaborative that's in the school system. We saw a 19% parental involvement increase in involvement and 10% increase in services provided by the collaborative. Again, just a very needed service that we have in the schools. Atrium also provides mental health services as well. And so it's terrific that we have all those resources for our kids and adult children and adolescents. In the community, we had 77 residents participate in mental health first aid classes. We definitely want to see that increase because that's a really good awareness tool for all of us to have. We also have a mental health solutions team that we restarted. That was initiated by Ashley actually the year prior. And really looking at some of our foster kids and issues with them being in the stuck in the emergency department for a while, and came up with a plan of some of the things and gaps in our community. That group started meeting again together. We meet every other month, and just looking at the different issues in the community and different resources and what we can do to perhaps impact and develop more programs in the community or work more collaboratively together. So that group is continuing to meet, and it's a different mental health providers that are getting together and having those conversations. And then again, the other thing I mentioned before is that we have a lot of messaging going out into the community on mental health awareness by both the county and by the schools. And the schools have a couple initiatives that they do throughout the year, and they always send me their information that they're doing. So it's great that we have a lot of that going on behind the scenes.
And now Stephanie runs the Mental Health Solutions Group. She picked that up and has it running again. Thank you.
Welcome, I think. And then our substance use disorder is our last area. And I just want to also say that mental health and substance use, really, you can't really separate the two from one another, even though we have, because they do really go hand in hand often. However, we do have two different groups going. And I'll talk about the group that we have, our task force that we have, but we have a results statement that the group came up with. One of the strategies, or two strategies we have our opioid settlement work group, so we do have our opioid settlement funding, and I know we'll come back to this group and talk more about that, a little bit more detail about the work that we're doing. And then the substance use disorder task force, so that is a group of different providers and community members that are working to address substance use disorder. And one of the reasons we started that task force is because there was so much, everyone was working in isolation, and we wanted to be able to get the groups together to start collaborating more. So it was a good way to have those conversations, and also to have more conversations about things that might be missing in our community, and ways we might be able to fill some of those gaps together. So some of the programs are listed here. These are not all the programs, and I do want to mention, even in the mental health one, not every program was listed under the programs, because we have like Daymark and a couple of other organizations in our community that really provide mental health services. So one of the indicators for substance use disorder is the rate of overdose deaths. it did spike up slightly, and I'm going to go back and make sure that this is age adjusted as well. But we have seen a decline in these statistics since 2023. We are starting to see a decrease in the rates. And then the number of opioid emergency department visits have gone down significantly as well. And again, this is per 100, all of these are per 100,000 people. So that rate has really, really diminished over the last year significantly.
What do you think the?
I think it's a combination of education in the community. I think naloxone is really helping a lot. Whether it's being self-administered or administered by the EMS group, and that's one of the things that we really been focused on is distributing out naloxone kits in the community. So in 2024, we distributed out 976, and so we give them to the sheriff's office. We have given kits to EMS. And we learned from EMS that they actually provide naloxone to pretty much everyone that they go to who's unresponsive, just because they don't know. It could be a heart attack, it could be an overdose. Naloxone doesn't hurt anyone if you give it to them and they're not having an overdose, but it's something that they utilize. And just even educating the teachers at the schools, the nurses at the schools all have naloxone now. So I feel like we're really curtailing a lot of those overdose, or preventing a lot of the overdose potential situations. I know we've given some to Wingate as well. And then in terms of the university, we are working with Wingate on our opioid settlement initiative and partnering with them, and they're developing a dashboard with all the partner information. So we've been working real closely with them. We actually passed our tobacco ordinance here, that falls in the substance use area too. Here in this building, any provider who accepts Medicaid has to be tobacco free. So we had to have an ordinance here. We were already smoke-free and tobacco-free in the building, but on the grounds as well. So that was a requirement to accept Medicaid. In our public health area, we do accept Medicaid. So we passed that. The Board of County Commissioners actually passed that at the end of November 2023, and we implemented it in February of 2024. And then our family treatment court, which received some funds from the opioid settlement. That was started in March, and they have treated over 40 participants as of the end of the year. And it's been really successful working with DSS on that initiative. So it's for parents who have children in custody, in jeopardy of being in custody. So the court's it's been really fantastic, collaborative, and Judge Hux has been doing a great job, and her staff. And then we started, like I said, that SUD task force, and we had met 4 times. That meets every other month, and so is the mental health one. And if anyone ever wanted to join either of those, you are absolutely welcome to, and you just can let me know, and I'll make sure you're on the invite list. So that's just some of the progress. And again, this is going to look a little prettier when we send it out. It doesn't really look very pretty in the system that we have to put it into. Just as quickly as I can go through here. We do compare morbidity and mortality rates year over year. We didn't see really much of a difference, although, and I know that we've presented information about chlamydia and gonorrhea rates. We did see a slight increase in the case rate of chlamydia, but we saw a decrease in the gonorrhea rates. Again, I know that we've had those presentations here. And then with fentanyl positive deaths, there was a 48% decrease between 2023 and 2024. So that's pretty big, that we're not seeing as many of the fentanyl positive deaths. And again, I think that naloxone has a little bit to do with it, but also I know that there's other substances coming into play now too. And then one of the other ratios that's always a little concerning is the infant mortality disparity ratio. So that's the ratio of deaths between white and black children. So in other words, when you're looking at this, there's 5.3 more to 1 deaths of white children. So 5.3 black children to 1 white child. So that's not a ratio we ever want to see. We want to see it going down. And I don't know the reasons why, but maybe our public health folks could tell us some thoughts about that.
So for clarity, that 24 went up, not.
It went up, yeah, it went up slightly. And I don't know if you have any thoughts about that. No?
Well, I asked Dennis before, he said, I know last, about maybe a year ago or so, said it could be, I don't know if it's education, but I thought they were going to look into that because such a disparity there.
Yeah. And then again, we're looking at emerging issues. I know that Dr. Broadway's come and talked about the avian influenza, so I am not going to attempt to talk about that again because he's already done a really, really thorough presentation on that. A couple of other emerging issues that we saw, the Clean Water Classrooms program expanded in 2023 and then turned into the Clean Classrooms for Carolina Kids in 2024. And let's see, it says, and I'm reading some of this because Tracy couldn't be here, and some of these are environmental health initiatives. So it says the approaching deadline is anticipated to increase enrollment in the program's lead-based paint and asbestos portions, increasing, some of this is very technical, the post-mitigation responsibilities of local health staff. The program was created to identify and eliminate lead and asbestos hazards in North Carolina, where children learn and play. It is legislatively mandated effort to address lead and asbestos hazards in North Carolina public schools, licensed child care centers, and licensed family child care homes. And participation allows facilities to meet all rule requirements for identified lead and asbestos hazards. And then immunization compliance, I think we've had this discussion as well. We've definitely seen a decrease in the compliance between 2020 and 2023. Our compliance rate dropped from 96.1 to 90.7%. And at the same time, vaccine exemptions for religious and medical reasons increased from 2.5 to 6.5%. So I know that, again, that's something that's been discussed already here. And I think the PFAS, substances in drinking water, is another presentation that Tracy also presented. And again, this is another thing that we can have environmental health talk a little bit more about too. So a couple of new initiatives, and again, I don't want to take up too much more time. We have our Child Health Behavioral Health Initiative, which is our partnership with NCPAL and AHEC, which is providing child behavioral health in our public health clinic. And it's based on the collaborative care model. And we've been doing that since August. And we have a social worker and who's our case care manager. And she is our liaison between a physician and an assigned pediatric psychiatrist. So we've been doing that for quite a while now, and it's been really successful. We have a Reach Out and Read program that our Dr. Tran had started, and shares the power of reading with families in our community, helping them to make reading a part of their lives, and gives children 0 to 5 years who visit an age-appropriate book at each well visit. Vaccines and blood pressure checks at child care centers. We did this as part of one of our grants, our REACH grant. So we went out to a bunch of the child care centers and actually provided this service to the workers. So we talked just about workers who don't make a whole lot of money, may not have access to health care. We got out in the community and we were able to do that with public health. And then Lead Safe Union community campaign. And again, I don't know Charlotte came and talked about that recently, but we had a really, really great lead prevention campaign in our community. And just a few more initiatives are written down here again. A lot of these are public health initiatives, and specifically their environmental health initiatives. I don't want to go through everything because there's just a lot of information here. And again, the report that will look pretty will have a lot more detail in it. And I can certainly get Tracy to present more. One thing I do want to mention is that we have our fast track STI screening service. So it's something that we implemented in February of 2024. It's no-cost service, provides confidential shortened visits for asymptomatic patients who do not want to have an exam. So it's a screening that we are doing some testing on. So it allows for early identification and treatment of infections. And then in terms of our paused initiative, we paused our wastewater monitoring initiative, and that was when Public Health had partnered with the University of North Carolina at Charlotte to implement a wastewater surveillance initiative to monitor COVID-19 levels. So that was something that was paused, that's been paused. And that is it.
What was that doxy pep, Stephanie? What is that? I'm just ignorant to that. I don't know what that is.
Yeah.
It's a prophylaxis for STDs. It is, so there is eligibility criteria for us to be able to dispense that medication, but it is, if it is given within a certain time frame after condomless exposure, then it can prevent some sexually transmitted infections. So we try to get it before they're infected. Thank you.
Any other questions?
Are there any initiatives being considered based off nutrition? Have they ever done those in the past?
So we have our WIC program here. So we our Women, Infant and Children program. So that is a nutrition-based program. So it's education on nutrition for pregnant women, and then postpartum, and also for 0 to 5-year-olds. So we definitely have that initiative. We have nutritionists that work real closely with the families that we serve. And then we have of course, our senior nutrition program. And then one of the other things that we are currently working on, a couple different websites. One of them is Healthy Living, and one is Healthy Eating. So that's some education that we want to get out into the community. Good question.
I noticed that on the 0 to 17, it was using the NC Detect, and then, but on the mortality, it used the national source, so which is delayed. And so I looked on the NC Detect just to see what more recent, data looked like. And it's not quite apples to apples, but where this ends at 22, right, in 2022, well, let me clarify, this is mortality. NC Detect is suicide ideation, ED, right?
Mm-hmm.
So, but we know that you had to have the ideation to have the mortality. So when we were at this score on the mortality in 2022, there were 930 ED visits for ideation. And in 2023, there were 931. Like, how many of those died by the suicide? That we won't know, for 6 more months.
Yeah.
But like it did stay fairly flat. We grew as a county, and
Yeah.
it stayed flat. So, but still alarming.
Yeah, definitely.
Can you do your,
Yes. We just wanted to provide a quick CD update. Please note on the slides, I will be presenting the T-ball game that rained out, so thank you for allowing me the opportunity to present. And then I used the template from last month, so note the change of date. But just for national North Carolina and Union County epidemiology picture, lab confirmed cases of rhinovirus and enteroviruses, which are the viruses that cause common colds. They are they're high across the nation, and we see that trend both in North Carolina and Union County. That trend typically peaks in mid-May, and then you'll see a decrease over the summer. But you'll note down in the summer trends, we're also gearing up for waterborne and enteric illnesses, which peak during the summer. Dengue activity, sorry, go back. Dengue activity remains high globally. Typically when we see a global increase, you're going to have increased cases in parts of South America and even in North America. We haven't had any cases that were domestic, so these are patients that have not had any travel anywhere, and we found that information out through our case investigations. But they have had outbreaks in Puerto Rico, U.S. Virgin Islands, and then a lot of times, what we have a concern of is when you have high global rates, you get cases imported and then potential spread. Overall, general CD cases are down for Union County, also really across North Carolina, and then neighboring counties are kind of seeing those same trends. Not really sure of any drivers of that, but we do keep close surveillance on that. And then H5N1 update, there have been no real significant changes. I did provide an update in the national picture of case rates. Luckily, no additional human deaths since the last report. And then just mention of summer trends. Typically, North Carolina sends out information and education campaigns for tick-borne illnesses. Fight the Bite, they'll usually send that out beginning of summer.
Megan, can I just ask you one question?
Yes, ma'am.
The data to collect this, is this in neighboring hospitals as well, or just public health facilities across the state? Like if you, these rhinoviruses and enteroviruses data,
Yes.
is this hospital reporting or just the public health department?
Yes, so they get that information from like the NC Detects, and since rhinovirus and enteroviruses are not reportable to public health, like in North Carolina, that's not a reportable condition. But that information is collected, and it does, we do collect that information in NC Detect. All right, for a measles outbreak update, there have been over 1,000 cases since the beginning of the year reported by 31 states. Closest states neighboring with reported cases were Tennessee and Georgia. 96% of those infected were unvaccinated. That does not include those with one dose of MMR. That was separate, and I think it was 3%, with the remaining being unknown. 13% of those infected were hospitalized, most of those being children under the age of 5. There have been 3 confirmed deaths. At this time, there have been no cases identified, knock on wood, in North Carolina. And then just as a picture, for our neighbors, we have a slightly less case count than Mexico and Canada. Cases are beginning to slow. So, typically with outbreaks, you see the incline, and then right now we're kind of at a plateau. This can be for a few different reasons. And typically with outbreaks, you see, it just kind of runs out of people to infect because you have immunity either from those that are vaccinated or those that have been infected. And then public health interventions as well. Some things we are still continuing to do in Union County. So we haven't, luckily, had any reports of any additional reports We had some last month of, we call them persons of interest or persons under investigation, so those that are tested. Everybody who has been tested has luckily been negative. And then we are working on toolkits for any potential responses that we may need. This includes education campaigns. We're getting together control measure templates. That way, when the time comes, we have them quickly to deploy. And then we are working to develop exercises in the responsive toolkit. So just making sure all of our community partners are engaged in and aware. And then also immunization outreaches. Typically this time of year, we start gearing up for childhood vaccines for back to school. And then we're kind of trying to package a lot of that together. And then for TB8 update, 6 of our active cases that were being treated have completed therapy. So we are down to 2 active cases that are currently being treated. Latent TB infections, there's a breakdown of the number or what progress, or what status they're in. And just to note, when it says there are 8 treatment not indicated, it's that we've done the evaluation and they were already treated for LTBI in the past. The rest of them are pretty self-explanatory, but if you have any questions, I'll be happy to answer. And then for contact investigations for 2025, our case that we have identified new in 2025, he was an extrapulmonary, and that did not require contact investigation. And that was it, pretty quick and simple. Any questions?
Thank you.
Thank you.
Does anyone have any questions? Thank you both for your presentations.
Thank you.
Do we have another presentation before we go on to the clinical piece?
No, ma'am. We were actually going to do that presentation just as part of the department updates, but
That works.
we needed to take that opportunity to make sure that the next agenda item was fully prepared.
Perfect. All right, so next up on the agenda tonight is the approval of requested public health clinical service fees. You've been passed a sheet with those numbers.
I'm going to cover this for Tracy. So obviously the sheet that you have before you is a little difficult to read for all of us who don't have very young eyes. And so it is also up on the screen for your viewing pleasure. But in short, the North Carolina general statutes allow public health institutions to implement fees for services rendered. And our process within Union County is to bring those fees to you all. And you all have to review them and approve them. And then if you approve them, we take them to the Board of County Commissioners to adopt as part of the budget. And tonight, what we have before you is 61 fees associated with our standard clinical operations. 13 of those, the first 13 listed, are new fees. All of those, except for one, are utilizing our standard fee setting method, which is the established Medicaid rate plus a 30% overhead fee for administrative costs. And the exception is fee number 86231, which is a celiac antibodies profile. And that one does not have an approved Medicaid reimbursement rate. It does, however, have an approved commercial rate. And so what we're recommending for that is the commercial rate plus 30% since it is an established rate. And then beyond those first 13 that are listed, there are 48 existing fees. And the reason that we're bringing those back to you is because there's been a change in the Medicaid approved rate. And so we want to bring those back and just adjust our rate again to the approved Medicaid rate plus 30%. So these, the remaining 48 have all been approved previously. And then what is not in your packet that was just handed out to you is an additional 89 dental fees. And those dental fees are also have all been approved previously as part, as you can see, of the FY24 and FY25 budgets. And those are going to be put up here for you to view as well. And what we are requesting this year, and we do this every year, is a 5% increase because we have cost of living, it's inflationary cost basically to cover increased cost of providing the service or purchasing the devices. So the request for you all tonight, I guess first is, do you have any questions about any of that methodology or anything else? Apologies for not including the dental fees initially. I have them for you now, so that is good. And the request for you simply is to review them and, if you would, approve them to be added to our public health fee schedule.
Which did you say was not on the Medicaid list?
It is 86,231, which on your page is at the bottom of page 36 of your agenda. It is the fifth from the bottom.
They're right after the new ones.
Yes, that is correct. And actually, no, I told you a story about that. I'm sorry. I'm so sorry. I need to call out the fifth. While we're looking at the fifth from the bottom, let me go ahead and call that out. I apologize. That one is actually 59,426, 7 or more antepartum visits, and it does not clearly show the recommended fee. I'm not sure why it didn't print out correctly on the Excel document. As you can see, it's there. It will show it, but that recommended fee is $1,316.60. The celiac antibodies profile, give me one moment. That is. Thank you very much. Good eye. In the 12th row there. It may be right above that actually, number 11, where it has 0 in column F there.
Make a motion to approve.
Second.
So we have a motion to approve and a second. All those in favor? Say aye. Any opposition? No opposition. That motion passes.
Thank you.
Can I ask a question real quick on that? I think I talked to I'm tired. I think I talked to Ashley about this before, but can you just clarify for me to understand the proposed amount versus what's covered? Like when it says Medicaid reimbursement, but then the actual reimbursement of the...
Absolutely. I think I can.
Okay.
So column F is the Medicaid reimbursement rate. That is what is approved by Medicaid. Column G is the approved commercial reimbursement rate. Column E is our recommended department fee, which in all instances for this is the Medicaid reimbursement rate plus a 30% of that rate admin overhead charge that is allowable also to be charged. So that is the methodology that we've utilized for as long as I have been here, I think. And the, again, only exception to that is the item that the celiac item that does not have an approved Medicaid reimbursement rate. Does that answer your question?
I think so. So the department fee is actually allowing, you're pricing it higher so that you can make sure that your Medicaid reimbursement is at least covering that fee of service.
Right. So, and Ashley Burtz, if you have additional information, please jump in here,
Yeah.
but
I would say the 30% that is an allowable increase is to cover the doctor that we're paying to write the order, and the nurse who's going to enter the order, and the lab tech who's going to draw the blood, and to have the lights on and the water running and all the other things that make the agency go.
so the Medicaid fee without that is for the service itself,
Just the lab.
just the lab.
Just
So you'll never have a time where you don't have a cost, a Medicaid reimbursement that covers that fee of service. It'll never be,
If we ever, oh, sorry, if we ever did, we would not add the additional 30%. Like it, so actually, so I know I said that that's been the case in every instance, but there have been times where there has just been an administrative fee. So a time that I can think of was during COVID, we had an administrative fee, and we just then, so there was a Medicaid allowable administrative fee for administrative function, and we just utilized that fee. We did not increase that to add anything extra to it.
okay.
The
So
only time we would do it is if it didn't incorporate something associated with administrative cost.
Okay, so your Medicaid reimbursement is always going to cover that fee of service. They're not going to undercut you.
Oh, well.
Okay.
That's not, that, so that may or may not necessarily be the case, and actually the celiac is an example of something that I don't know that we want to get into the detail, because I'm not sure that we know completely, but that is a test where we're not exactly certain how much that one is going to cost us. It may cost us significantly higher than the recommended rate by literally $100 or $200 more. If it does, then we may come back to you with some different recommendation at that point.
Is there ever a time, okay, if Medicaid doesn't cover that full service, does that cost fall on the Medicaid patient to make up the difference?
No, it falls on Union County.
It falls on Union County.
So basically, correct me if I'm wrong in this, Ashley, but if we provide a service or a vaccination or whatever, and we bill whatever rate that we bill, if our cost, let's just say it was vaccination, because that's a little easier. If our cost for that is higher than our bill rate, then the commercial reimbursement would be what it would be, the Medicaid reimbursement would be what it would be, and Union County would cover the remainder of the cost. Our goal is to not have that happen unless it would be something that would preclude an individual from being able to receive a service that is a necessary service, and that is a very rare thing.
Do you have money set aside for that instance? Like if you end up Union County ends up having to cover the cost, is there like a pot of money
When you
somewhere
say
for that?
Union County, what is that? Where's that fund? What's that money come from?
It would come from our operational budget if it were to occur.
Okay.
And what we do is we look at the fees, obviously, throughout the year, and then every year, if we were to see something occurring like that, right, we would have a red flag that we would raise and say, this is maybe not a good thing. And so we would take a look at that and talk with the Budget and Finance Office, and then bring that back to you guys for consideration for mid-year change or something else like that.
So there's not a fund set aside to cover those costs because they're
There's
unanticipated?
Definitely not a
right?
fund
Okay.
set aside to cover those costs.
Basically, Medicaid client, this is for like more non-Medicaid client, because a Medicaid client cannot be charged more than that Medicaid
That's
rate.
correct. That's correct.
Right, but then, so this is the fee that's charged, right? And then you recover what you can if there's insurance or Medicaid, but this is the fee due for those who are uninsured.
Unless they're on a sliding scale, so it would be the starting point. Is that correct, Ashley? Okay.
Any other questions on that? Excellent. Lost my place. All right, I think are open for public comments and announcements.
Start over here, over there.
Having no public comments, do we have any announcements?
I think we'll go, I think we may have some with the departments.
Yeah, I just wanted to mention that we completed our community health assessment surveys. We had over 700, I think we had 790 completed surveys, although we had almost 1,000 in total submitted, but some people didn't finish their surveys. And now we are in the process of doing some focus groups. So we're doing some with teens, and we did a couple with the senior population, the homeless population, the Latinx population, and a couple other populations. And then we also are one of the guinea pigs, for lack of a better way of doing it, with our collaborative group, doing an AI-generated key informant interviews. So those are going to some of our community partners. So we'll kind of see how that works out. But we have, I think, 18 of those out in the community. And again, that information is primary data that we'll use, compare it to, well, we look at our secondary data. That's our statistical information about the needs in the community, health in the community, and compare it to the primary data. And then we'll have our Healthy Union Advisory Coalition. We'll do some presentations on all the data, and then we'll come up with priorities in our priority setting. That's it.
Hi everyone. I wanted to share that our office is half renovated. So we were homeless basically for 2.5 weeks while they did our floors, and we used to have the black and white like barbershop tile. We now have really nice LVP and new carpet, and I'd love for all of you to come by and see it. And then the latter half of it will be done in the fall. So I'm very excited about that. Thank you.
Hello everyone. I just wanted to share that May 16th through the 23rd is National Transportation Week. We will be celebrating that in our office from the 19th to the 23rd. We worked with communications to create some videos of our passengers from UDI, nutrition, and dialysis. So we'll be sharing them on social media. And we've also done a video in our office to highlight what we can do out in the community for our residents. And we will be celebrating our transportation staff with a breakfast and also doing a raffle for anyone who has traveled with us that week. Thank you.
I have a question while we're on transportation. It doesn't really, I don't think, fall to you or to Stephanie, but perhaps y'all know, do we have a travel training resource in Union County for individuals when they come up through the school, like with IDD, like to learn how to take the bus, to learn how to call for the transportation? Do we have a nonprofit or church or anyone doing those trainings?
So we are actually working with a pilot TDM that is working to get who are they working with, Jen? Do they have anyone right now?
Well, so Centralina is doing a TDM, which is Transit Demand Management Program. And part of that, as Teresa mentioned, is one of the things that we're looking at is a pilot for the travel training resources. And we have had a meeting with Wingate, and my brain just went completely blank. The disability out of Mecklenburg County.
Disability rights.
Disability rights, and thank you very much. I apologize. They are currently able to develop that training for Mecklenburg County, but Centralina is exploring the opportunity for them to be able to develop a similar training for Union County residents to do the same. Right, exactly. And so not yet, but hopefully in the relatively near future is the answer to that.
Thank you.
Thank you for asking.
Good evening, board members. May, you may not know, is National Foster Care Awareness and Appreciation Month. And we need foster parents. So I need you as board members to find me some foster parents. Also, keep your eyes open because we are trying to come up with some very intentional and creative ways to engage residents in Union County to open their hearts and homes to foster children. So if you have any connections with faith groups, book clubs, we will take anything. And if I don't have staff, I will come and personally speak and engage with those folks and try to encourage people and talk to them about the myths, the facts, the questions, the answers, and everything that goes along with foster care in Union County. So, stay tuned and let me know if I can come recruit some of your people.
When you say you're looking for foster, are you talking about for professional foster parents, or are you looking for people to
Just your
like rapid
regular old
resource
foster parent.
All right, thank you.
Just, I want to help and I love kids and I'm a little crazy because I'm going to open up my house to people I don't know because I want to make a difference. Yes, ma'am.
Is there like an average length of stay when someone takes in a foster child?
I mean, I could do math on it, but it just, all of them are different. Typically, when kids come into care, we try, the state wants us to attempt reunification with their parents within 12 months. I'll be honest, that's very difficult, and most of the time that's due to the reasons why they were removed from the home anyway. There's typically, in many cases, substance use issues. Those aren't going away in 12 months. And then there's court issues with delayed court appearances, court dates, that sort of thing. So 12 months is what the state tells us, but it doesn't really happen. So as long as you are willing to care for them, I think the best part there is consistency, and it doesn't always happen for kids, but our hope is that if a kid comes into care, they're able to stay with their foster family, who then works with us and works with the birth family together to work towards reunification. That is the most ideal situation.
Thank you.
Yes, sir.
Question, Ashley. So, have the rates changed? What are the current rates, and do you also have a therapeutic foster training program that can help some foster parents who say they're a little bit experienced, but they're ready to take that big challenge to be a therapeutic?
So Union County DSS does not operate therapeutic foster homes. We allow private agencies in our community to handle that. So you would need to become licensed through one of them if you want to become a therapeutic foster parent. That means that you would receive a higher rate, but you're also expected to do more trainings and be prepared to accept children who have higher acuity levels in regards to their behaviors and mental health needs. We do have just your regular old foster parent, foster kid relationships, and we license those here in Union County. I don't have the current rates memorized. They were just increased last year. And then, of course, we always encourage familial or friends of the family to serve as placements as well.
Kinship care?
Yes. They now allow for us to pay a monthly stipend for kinship care. 2 years ago, that wasn't allowed, and the state has finally realized that families who bring in kids from their families also need some assistance in raising those kids, just like you would with a foster parent. It's really cool.
With regard to that, have you had any cases or any luck with going backwards where people weren't informed on that for the kinship care, to go back and obtain the funds?
Yes, we have had some success with that. And anytime a kid disrupts that, and we haven't, like, if they were in care last year and then they disrupt that placement this year and they can't stay in that foster home anymore, we're immediately going to go back to bio parents, ask for any newer, updated, or current familial placements that could be a possibility, and then we re-ask those people before we look out for foster parents. But even with that, we're in desperate need for foster parents in Union County.
And have y'all, you said you use private entities if they're doing training and stuff. Have you ever co-hosted like a resources for resilience, rapid resource, like any type of training to try to get people?
We have not and don't plan to, because we are doing our best to offer our own MAP classes for our regular foster parents every I think we're doing it now 5 times a year, and that's pretty intensive. So it's 40 hours, and they meet once a week until they reach that. I don't know the number of weeks.
Thank you.
Mm-hmm.
Right, I just have one more thing. I want to give a quick shout out to transportation. At the end of April, we had a super successful North Carolina Public Transportation Association, which is NCPTA, conference, and it included a rodeo driver skill competition that we had 6 of our drivers participate in, an excellence gala for those drivers, a business partner expo, and then a couple of days of learning and engagement and collaboration. And Teresa Torres served as one of the conference co-chairs, and she would never brag on herself about this kind of thing, but I want to brag on her because I'm just so proud, not only of the fact that the awesome work that she and her team do, but of her leadership in this space. And it makes a big difference locally and across the state with transit partners. And you know, it's really cool because with most everything that we do in all of our services, our sole goal is to serve our neighbors, right? As Ashley said, to provide love and care for those who need it. And sometimes that is not so easy, and the resources are difficult to come by. And every team member that you've heard from tonight really goes just above and beyond to try to make sure we maximize our fiscal resources wisely. We bring in non-local dollars where we can to be able to provide services, and most importantly, just have care and compassion for the people that we serve and try to do that in a way that's meaningful. And for transportation specifically, and really everything else, it empowers people to live in place longer. Senior nutrition has a similar effect. Improves also quality of life for both riders and their families. And so thank you, Teresa, to you for your leadership here and across the state. And we had a letter that came into the Board of County Commissioners, or to the clerk to the board, that was shared with the Board of County Commissioners. And I just wanted to read that to you guys. And we have lots of these kinds of things come, really probably more so just to Teresa or to the office, but this is just an example, and it's an example that this happens to be about transportation, but it really could be applicable probably to any one of our services. And it says, Lynn, who is the clerk to the Board of Commissioners, I totaled my car in October and decided that at my age I did not want to drive anymore, so I've been using the county transportation system. It is wonderful, and I'm so grateful that we have it. I want to thank whatever agency was responsible for securing it. The requests for service are answered promptly and courteously. The drivers could not be more helpful. They get out of the bus and help us get off and on. My dentist is in Matthews, and I can go there on the bus, and to my Ortho Carolina appointments in Charlotte. I'm so happy that we have this system in place. A fringe benefit is that I often get to see places I didn't know existed while others are being served. A mini tour of the community, and it is all free. Thank you for this most worthwhile program. Pretty cool. So, yay, thank you.
Thank you, that's awesome. Congratulations to you. Thank you all for your presentations. If we have no public comments, then we can adjourn if we have a motion to do so.
Motion to adjourn.
All those in favor? Aye. Thank you all.